Hi everyone,
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHILL, the Civic Health Innovation Labs.
CHILL's an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bring innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHILL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as what are their day-to-day tasks, how did they get into the role that they currently have, and what advice would they give if you are interested in getting into this area of work yourself.
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City region. Hello everyone and welcome to Health Data Decoded with me, Samuel Ball.
And me, Ed Hill.
So today we're joined with Will Whitaker and Liz Camacho, who are health economists from CHILL. Can you just start with telling us a little bit about what health economics is? Because I don't know entirely what it's about, but you guys are experts.
Yeah, so economics is essentially about how you make best use of your resources, and for health economics, it's about how you make best use of health resources. So when we talk about health resources, that can be the NHS budget that you'll hear about in the news. It could be the workforce, GPs, nurses, hospitals, and how we provide healthcare and different ways of providing healthcare. So we look at those things, different ways of providing healthcare. What's the best way to provide healthcare? And that will include some of the topical issues around should the NHS be provided by the private sector or the public sector. It will also include should new drugs be provided by the National Health Service or not. And it'll also look at why individuals invest in health and why they don't invest in health as well. So it's quite a broad area. And as you might imagine, that means that health economists do work in lots of different clinical areas as well. So we'll have people working in dentistry, sexual health, public health, focusing on primary care and so on. But there's kind of three main questions that health economists will look at, and that is, does a new way of doing things, a new way of providing healthcare or a new drug, does it work? And does it improve what we want it to improve? Is it value for money? Is it worth the money? That's what most people think health economics is. It's a bit broader. Hopefully I'm getting that across to you. And can it reduce inequalities as well? We're also interested in that as well. So in terms of my personal interest, that's around access to healthcare. So I'm very interested in how we can make sure that healthcare systems provide equal access to services based on need.
Yeah, so I think for me, just echoing what Will said there, so as Will said, so that work across lots of different clinical areas. So I work across lots of different areas, and that's one of the things that makes being a health economist quite interesting for me. So I mainly work in mental health and reproductive health, but I'll get involved with most things if the work's quite interesting. So I do the bit that most people think health economics is about. So I focus on the is it worth the money type of questions quite a lot. And so you can do that in different ways. You can do that working in clinical trials or doing modelling and things like that as well. So there's lots of different questions and lots of different methods that we use in health economics.
That's brilliant. Thank you for the overview. And so just an anecdote from my side. So being involved, my first postdoc project then had a health economic component to it. We were looking at cost effectiveness of routine vaccination programs, and this was my first exposure to health economics at that time, and then thinking about, okay, is it value for money, essentially? But then through time, then learning about, health economics is so much broader. And actually, it's a vast research discipline in itself. So no, it's great to have you both here to offer these perspectives and share that with our viewers and listeners. And so with that, in terms of, say, your own journeys to kind of where you are now and working in health economics and doing research in that area, how did that develop, and how did you end up kind of being linked to CHILL-based projects?
So for me, I joined the University of Liverpool just as everything was chill, was like really kicking off. And so although my PhD was in epidemiology originally, but because quite soon after that I moved into health economics, I kind of hadn't really kept up with the advances around data science and that sort of thing. So for me, chill like represented that opportunity to just get back into that side of things and explore how I could kind of, bring what I'd learned in that decade in health economics together with the more data science side of things. As well. So that was kind of what chill like represented for me at the start. But for me, I love how multidisciplinary chill is. So, there's you speak to people doing loads of different things, different methods, different disease areas. And also in chill as well, we get, international visitors from around the world telling us what we're doing. So you can just, on your own doorstep, you've got the globe coming to you to tell you all about these things. So it's really fascinating.
Yeah, so for me, I joined the university about a year ago. So chill was already developed by then. And it was actually one of the unique selling points for convincing me to come to the University of Liverpool. So what I really liked about chill, because it links directly with what I try and do with my research, is that it's bringing together and it's helping to provide that catalyst for the health system and academia to come together and to answer those big questions. So that's exactly what I want to do. I want my research to actually change things for the better, and chill is a useful way for doing that. So that's how I've got involved, and since then been presenting work there, had lots of useful feedback, and people have presented their plans and projects, and I've been able to get involved in them. So it's been a really great initiative, I think. And we will say that, won't we, on the Chill podcast? But yeah.
Yeah, thanks for that. Yeah, it's really good how, my experience of chill has just been everyone being brought together. I like how it combines the qual and the quant side of things. So you have the data scientists and the statisticians, and then you have people who are more qualitative and talking about like what needs to be improved, what are that, and it kind of brings the two together, because so often I feel like we're siloed, and I think chill's brilliant in that it brings people together. So on that, I know, Will, you did a presentation a few weeks ago that I thought was brilliant about the Health Economics and Equity Group in Liverpool, and I know both of you are involved in that. Can you just tell me a little bit what that's about for our listeners and why it's kind of unique in how it approaches things?
I'll try and be brief, it's one of our babies at the moment. The only type of baby we can have is one of our babies at the moment. So it's actually the reason I joined University of Liverpool. So I was at the University of Manchester, and I was really content. But there was an opportunity to help develop a health economics identity at the University of Liverpool, and those opportunities don't actually come up that often. So it was quite a nice opportunity. So I joined, as I said, about a year ago now, and we spent a lot of time coming up with our aims, our visions, our objectives, and I won't go too much in depth into those, but ultimately this is about bringing together people who are interested and doing work around health economics at Liverpool to try and provide useful evidence to support the health and care systems, not just in Liverpool, but in England and more broader as well. So in order to do that, we plan on working with academics, with the healthcare system, other providers, governments, charity organisations, getting to understand what their key research questions are. So a lot of the time research is driven by the researchers, and I think for really impactful research that can make a difference, we need to be engaging with different disciplines and so on, which is why Liverpool is such a great place to be in, why I enjoy chill as well. And yeah, so that's what we're doing, and we're rolling out and increasing the amount of teaching we're doing, having lots of conversations, making lots of collaborations, and hopefully growing and growing and growing.
So I think Will's kind of given our more, I guess, corporate side of the vision of what we want it to be.
I'm corporate.
But so for me, I guess more on an individual level. So health economics can be quite hard to get into from the outside, but there's so much demand for health economists, and there's so many relevant skills from other areas that could come in and like enrich what we do. So for me, I would like HEAL to kind of facilitate people from different backgrounds to kind of move into health economics, kind of shape what we're doing. And I think the other side of it as well, it's really important to both of us that HEAL is seen as quite a collegiate group, and that we want to kind of support and develop each other, you know, both at our level and kind of, you know, more junior researchers kind of coming up. And so, you know, I think what we both want, we should just want health economists to know that HEAL is a great place to be and to want to be here with us. Who wouldn't want to join this party? I mean,
absolutely. And so you kind of remark upon there, like building this community, and this involves like training the next generation as well and getting them involved. And so something we've been asking you all, I guess, is essentially in terms of just like day-to-day activities, kind of what do you get up to? What does that entail? And so I suppose this is on the research type, but also importantly on this teaching and skills development side as well, the activities you might carry out there.
So for me, the majority of my time is spent kind of talking to people, and that is across the university, the city, the country, the world. So I really enjoy meeting people who like really care what they do. You know, you speak to someone and said, "Oh, I've set up this grassroots thing, and we're doing this fantastic stuff." And it's like it's great to work with people like that because like you get their energy, and you know it's really nice to be like that. And like I've found for me in Liverpool in particular, like there's no shortage of those conversations. So many people doing some great stuff, and they're so enthusiastic about it. And for me as well, so before moving to Liverpool, I had a little bit of teaching contact with medical students, but I have a lot more now, and they're fantastic. They're so engaged and they're so enthusiastic about what they're doing. So again, it's a real pleasure to teach on that as well. So my day-to-day, unfortunately, I don't get to do as much kind of hands-on analysis stuff as I would like to do anymore, but I think that kind of is, you know, part of the course. But I do put more time into developing others, both staff and students, and I do get a lot from that as well. And I think, like many academics I speak to, I suppose I get my like real work, so writing papers, writing grants, that tends to just be done in the evenings when the meetings have stopped, which is a bit of a, I don't know what the word for it is, a job hazard, but it's kind of the way things are, I think, at the minute for everyone.
Which is something we definitely don't recommend.
No, we do not.
So a bit like Liz. My what I love about my job is that it varies from day to day. So a lot of it physically is online meetings, which is great in moderation. Sometimes you can have a full day of meetings that can be draining, but the people who I'm meeting on those meetings can vary so much. So sometimes it's students who are advising them. I might be their academic advisor. It could be they're wanting some support for a potential project dissertation that they're working on. I'll be meeting with people from the health and care sector and understanding what their needs are for evaluations and so on, and I'll be meeting with Liz or other colleagues on projects. So some of those will be funded already, some will be in kind of their formation stage where we're thinking coming up with grant proposals to try and get funds to do those projects. So the meetings contents vary, but the format is largely online, but we do have some face-to-face meetings. But yeah, it's varied.
It's varied, but this really shows the different audiences that you interact with on a daily basis, and so the context, the purpose of these meetings is so varied, and this is actually perhaps something we don't appreciate ourselves, this skill we've developed over time, which I guess we're not really taught this, it's something we just develop, right? As we get onto multiple projects ourselves, start engaging with new groups, new people. So it's one of these skills which, looking back, is from being a PhD student, I would never have thought about. You're going to have a meeting, be supervising new students yourself, and then meeting with government agency people or industry people or other academics, and then how very different each of those contexts is, and how that's actually an incredibly important part of our job, which I think perhaps we underappreciate ourselves. But
yeah, it's difficult, isn't it? Because I think when you're a PhD student, you're kind of single focus on just doing the research and getting your thesis out. But I think when you move to the kind of lecturing and further on in the academic journey, it becomes so much more multifaceted.
Yeah,
so on that, so I think we've talked a bit about research, and we've just touched on the teaching, but outside of those meetings and outside of the research, can you speak a little about what other stuff you get up to in your roles? So kind of like the extra stuff that we might not know about.
So as you imagine, with different projects and teaching and students, there's actually a bit of project management even to what I'm doing, but there's also line management of staff, so there's supporting them, and it's you tend to develop those skills as well. So you're kind of focused on your research, and you might be an expert in some area and teaching on specific things, but then you've also got these more broader transferable skills around leadership and management and so on. The other thing we do is review other people's work as well. So I'll spend time reviewing someone else's work where they're aiming to get their work published in an academic journal or looking to get funded. So that takes up some of our time as well.
Yeah, so I think for me, mine's kind of around like funding. So one of my favourite kind of other bits of the role is I really like sitting on funding panels, because it kind of really feels like you're kind of peeking behind the curtain and seeing how, that works. And it can be quite intense doing some of the funding panels, but you learn so much from it as well. And like, there's some of the things that kind of are probably kind of really common mistakes that people make that no one kind of tells you about. It's coming back to this thing of like the skills no one really tells you you're going to need. And so seeing it from that side, you can see why that's a mistake and what the funders want to see and not want to see. So I've done quite a few different ones now for some of the different funders, but I think one of my favourite standout panels I did was one for the Wellcome Trust, because it's proper like how the other half live over at Wellcome. And so every tea break they bring out this mountain of freshly baked cookies and coffee, and so that was a real pleasure, that one.
That's it. I've not had the joys yet of being on a funding panel, but that sounds like a good one to be on for sure.
Highly recommend.
Definitely. Great. So we've spoken a lot about perhaps different roles within what you do day to day and some of the other activities, and then in terms of when you outlined at the start what health economics is and your own specialism within it, is there anything that's like surprised you in terms of a skill you've needed or had to develop, which perhaps at the outset you just never anticipated you would need to have to carry out your work?
So I think, for me, when I kind of started my research career, so the whole kind of patient and public involvement movement was only kind of just beginning, and it was all new, and certainly wasn't like a core part of the research like it is today. And so now, while there's lots of kind of courses and trainings, even for PhD students, you receive training on how to do all that kind of thing. In the early days, it was all very much like a self-taught baptism of fire type thing. And there's some element of that's a good way of learning, but there's another element of that you can end up in a situation that you're just not skilled to deal with as well. And so I think for me, I've kind of done previous things where I worked as a GP receptionist, or I did volunteering with elderly people and things like that. So I think that probably helped me with those kind of skills, but I never kind of would have thought. So like when you're in school and teachers say, oh, this could come in useful one day. Is those kind of things you don't think will come in useful that might actually? And so but how that kind of comes in with the health economic side as well. So there was one example for a study, and I was working with people with dementia and their caregivers, and we had kind of designed an activity so that they could all kind of join in, and that we essentially used the output from that into an economic decision model. So it was really nice to be able to kind of go through that process and actually, to kind of usefully use that activity. And I think that's again probably another marker of how like the research culture has changed now. So in a lot of journals you will have to say what was the patient and public involvement in this. So it was really nice for that paper we were able to say, well actually we did this activity, and what you see here in this model is what came from that activity. So that's kind of made it kind of feel like it'd come full circle. So that was kind of like one of those unexpected skills, but it's actually quite nice to do as well.
Yeah, so for me, I'm thinking back to when I did my PhD and was trying to work out what I wanted to do in my career. When I decided I wanted to be in academia, so that's doing research and teaching, I originally thought that my audience, the type of people I'd be working with, would just be other economists. So my PhD was in economics. And what I've learned over 16 years since I did my PhD is my audience is much wider, and my research is much better because of that. So big skill I needed to learn was how to talk to non-economists. So hopefully I've not done it in this, but we do tend to use specific terms that are relevant to our discipline. And sometimes those terms are called something else in a different discipline as well.
Pitfall was there.
So there's learning how to speak to, say, statisticians, and there's learning how to speak to qualitative researchers. I'm a quantitative researcher, and understanding and valuing each other's disciplines and so on. And that's just within academia. Then there's how to speak, and when I say speak, I mean kind of transfer my findings and the approaches that I'm doing. I don't just want it to be to other academics either. I want my research to actually change things. So I had to learn how to speak to non-academics. So the health and care system, for example, understand the best way to get my ideas across to them. And recently, to patients as well. So what I've really learned is the value of reaching out to patients, clients, service users, and understanding what their key research questions are. I did an event yesterday where I was presenting what health economics is, and that was to the general public. And I'd argue I got more out of it than they got from it, but it was great. But yeah, those types of skills I just didn't think I'd need. I thought my audience would just be economists.
And I think so for me, as I said, I come into health economics not from an economics background, and economists in particular, they love their big words and they love their equations. Like all economists and papers, you get can I get my massive equation in this paper just somewhere, just so everyone knows it's an economics paper. So I hear the need for that different communication.
It's so funny, isn't it, when we talk about, we're kind of both from mathematical backgrounds, and there's certain kind of trials of fire that you have to do before someone takes your work seriously. And then I've talked to clinicians and doctors about it, and they just say, we just don't care about any of that at all. And they've got a completely different set of questions they want to answer, and you just think, oh God, like there's so much going on there. And because I think that as the healthcare system evolves and there's different challenges and needs for it, I think the whole kind of setup gets more complex, and that need for communication gets more important because there's so many moving parts here. We've had you guys on as health economists, and we've had public patient involvement people on, we've had data engineers, data scientists, project managers, and they all need to be able to talk to each other. But it's just so kind of difficult, isn't it, when we think about, we all kind of live in our own bubbles, and getting across those is the hard part.
Absolutely, yeah.
So we're asking this question to everyone because I think it's a really nice question, because we would love to get people more involved. As health economists, if other people want to get involved with health economics, do you have any advice for people if they want to start their journey?
Yeah, my first bit of advice is a bit of an advert to say, if you're thinking it's important, then it is important. And I will always find a way in which health economics is relevant to whatever you're doing, if it's around the health and care system, public health, more broader. Part of it is trying to break down that wall, a bit like what we were talking about, so that people know that they can approach us, and that the door's open. We want people to approach us and to have those conversations. In terms of what I'd like them to get from this, a sense of door openness, if that's a word, that we're here, and we would love to reach out to you, and love for you to reach out to us, and hopefully, if anything that we've mentioned today sounds relevant and interesting to the work that you're involved in, do get in touch.
Yeah, so I think for me, just adding on that, so I totally agree, but I think that one of the kind of messages I think that I always feel the need to put out there is that we're not the bad guys as health economists, so we don't make the decisions about what healthcare should be funded. We just try and produce the best quality evidence that we can to inform the people who do make those decisions. So we're not the bad guys, we're the good guys. But also that, I acknowledge that kind of from the outside, health economics can seem like a bit daunting, and you might just kind of feel like it's a bit alien, it's a bit over there. But health economists do come from a range of kind of subject backgrounds into it. So if you're interested in joining us also, like working with us or joining us, becoming one of us, then yeah, just people to reach out to us. Door openness.
Door openness is definitely a word, definitely now a word. Should definitely make use of it. And what you've remarked on there in terms of people having the different perspectives, different backgrounds, experiences, that's a very common theme from our past episode as well. Just across all these different roles, actually, it's not a case of I did basically training to be a data engineer or health economist or public involvement engager. And from the outset, people have had their own journeys navigated and ended up in their current role now, but it's been very varied experiences, so it's great to see that also come through here. And I think with the interdisciplinariness, and so Will, you mentioned about during your own PhD, thinking about I'm the chat just to other economists, but actually I think we're breaking down these barriers, right? Projects are inherently interdisciplinary to make the biggest impacts, and therefore the initiatives like you got with HEAL, I think it's like, door openness, breaking down boundaries, opening opportunities, people, so thank you for creating that opportunity, and it's great to see how it's going to develop.
So would you want to reach out to HEAL? Have we sold it enough for you?
Yeah, of course. Get a nice long email from me very soon. Well, thank you, Liz and Will.
Thank you.
And thanks to our listeners for joining us. If you want to follow us on Spotify and YouTube, you can. The video is on YouTube. And we'll see you next time for Health Data Decoded.